Good morning, Peter Goertz. I'm a psychiatrist. Let's talk about sleep. I'll mention a few tips. It's a huge issue. And part of what I do is working in an outpatient psychiatric clinic. And one of the major, most frequent complaints of patients is poor sleep. Whatever other issues they have, often poor sleep is a major issue. So it's very common, and patients in general can get quite desperate when they're not sleeping. Of course, that interferes with daytime functioning then. So thinking is a big problem with sleep. So thinking, in a way, is the bane of our existence. So the less you think during your time in bed, the better it is for sleep. And often, even when we're not in bed, we think way too much. So it's easy to say, of course, but if we can cut down on our thinking, that can help enormously in our functioning with sleep and our functioning in general. So if you're lying in bed, and I'm not maligning thinking, of course, thinking you need to function during the day also, but there needs to be a good balance between thinking and at least not thinking so much. So while you're lying in bed, it's good to avoid thinking. And one way to do that is to get out of your head and into your body. So instead of thinking, focus on your breathing, on your body, feel how your hand feels, how other parts of your body feel. And that will automatically get you out of your head. But then, of course, thoughts can want to come back, so you may need to go back and forth. But that's still better than thinking the whole time. And things that can help with being able to avoid so much thinking are meditation, yoga, tai chi, acupuncture, and being immersed in things that you enjoy, hobbies, sports, whatever you can really immerse yourself in and enjoy. That can help you not to think and to be in the moment. Essentially, that's what we're talking about. Even in bed, while you want to sleep, you want to be in the moment and feel your body instead of thinking, and that can definitely help you with sleep. So to me, that seems like maybe the major issue with people who have trouble sleeping is thinking, because they think about the future, they think about the past, what's going to happen tomorrow, what a mistake I made yesterday, oh my God, 10 years ago, this and this happened. So all that can interfere with sleep because your mind is constantly running. And that's the way patients put it often. My mind just won't stop. It just will not stop thinking and thinking and thinking. Now, it's easy to say, of course, to stop thinking, and especially in people who are severely troubled, like if someone has PTSD, it's easy for me to say, stop thinking, but if they get a memory that just implodes inside of them, that can make it very difficult not to think. So I'm not saying it's easy. And similarly with major depression, if someone's severely depressed, that can make it difficult to avoid thinking. Or if someone's had a major life stress, huge stress like the death of a child. So again, it's easy to say and simple, but it's not easy to do. Another thing that's helped me, and that can help in general, I think, in life as far as health, but also as far as sleep, and that is nose breathing. So that hopefully can help you avoid snoring, avoid sleep apnea, so avoid stopping breathing during the night. So what I've done for about the past year and a half is just put a piece of micropore tape on my mouth, and my wife has not complained about me snoring anymore. So that's worked very well for me. But if you want to try the tape, please ask your doctor and make sure it's safe. So breathing through your nose in general can be very helpful. It increases nitric oxide, which is very healthy for your body, for circulation. And that will hopefully help you avoid snoring and sleep apnea. Many things can interfere with sleep. Physical pain is a big one. Other physical problems like shortness of breath. So you want to have physical issues addressed in order to be able to sleep well, at least addressed as well as possible. Medications can interfere, like Adderall, stimulants, Steroids, caffeine can interfere, street drugs, of course, methamphetamine keeps people up for days sometimes. And alcohol can interfere in the sense that it can help people fall asleep, but then people tend to have less restful sleep and wake up during the night more easily. So all these things can interfere. A big meal at night can interfere, cause heartburn, and also you don't need the calories late at night because you're not moving that much, you're not that active, you're just sleeping. So it's better to have your big meal maybe for lunch or even breakfast instead of for dinner. And that can help your sleep also, because if you have your big meal at night, your body's going to be working all night, or at least part of the night, digesting that meal instead of just relaxing. Sleep hygiene in general is important. So other issues to consider are, of course, you don't want to have the light on in the room while you're sleeping. You don't want it to be at a temperature that's unpleasant for you. You want to have a temperature that feels comfortable for sleeping. You want it to be quiet. And also you want to respect your body clock, because our bodies have an internal clock and we don't want to disrupt that as much as possible. So you want to more or less try to go to bed around the same time every day and get up around the same time every day. Cognitive behavioral therapy for insomnia can help. And of course, one of the main things, especially in our culture, people are looking for is a quick fix. So, doc, please give me some medicine for sleep. I want to sleep. So that's our culture with its quick fix mentality. And that, of course, can help. Medications definitely for sleep can help. However, like many things in life, there are different aspects to it, and medications are always a double-edged sword. They can have helpful effects or unhelpful effects, side effects, adverse effects. So some examples of medications for sleep are trazodone is very commonly given, hydroxyzine, Benadryl, so antihistamines, Benadryl is even over the counter, melatonin. Even melatonin can have side effects. It's a natural substance, but especially in higher doses, it can have side effects. Benzodiazepines like Valium, Ativan, Restoril, and Ambien are given sometimes for sleep, but the benzodiazepines and Ambien can be potentially addictive. It can be very difficult sometimes for people to stop using them for sleep once they've started that. And even Seroquel, an antipsychotic which is sedating and can help with anxiety, is often given for sleep. It's not a first-line treatment that we usually resort to, but it's something that if someone's desperate or really having trouble and not functioning, sometimes Seroquel is given for sleep, and it can help. But of course, like any medicine, like I mentioned, it can have downsides. Even tardive dyskinesia, like movements like twitching that may or may not go away. So you definitely want to inform each patient about potential problems with medications before you prescribe it for them. And of course, medications are a symptomatic treatment. They do not get to the underlying issues. Thank you.